Most people think the gastric sleeve is simple and easy, and that's where they get it wrong. Anyone who's had this surgery would agree. The sleeve has a strong safety and weight loss profile, and it is the most commonly performed weight loss surgery in the US. But the sleeve will not do all the work for you. It requires compliance to your bariatric surgeon's medical and nutritional guidelines, as well as behavioral alignment. It is also not the best option for everyone, as some people experience new onset reflux or worsening of pre-existing reflux. There are also lifelong recommendations and restrictions regarding things like smoking, alcohol intake, carbonated beverages, NSAID use, and nutritional supplementation. The sleeve is a powerful tool, but only if it's right for you. That's why it's important to have a thoughtful conversation during your consultation with a bariatric surgeon, so you can make sure your expectations align with the realities of this procedure. If you want my top 3 questions to ask a bariatric surgeon, see the link in the video description below. I also discuss the gastric sleeve in detail, and you can get that information on the PDF as well. I'm a physician assistant with 20 years of experience working with bariatric surgery patients, including endoscopic weight loss procedures and weight loss medication. If you're trying to decide which weight loss option is right for you, click that subscribe button. I release 3 videos a week that help you think through and understand all the options in the professional weight loss world. Thanks for watching, and I'll see you in the next video.